And my screen says we're live.
Okay.
My screen says we're live.
All right. I'm still thinking.
Hi, everyone. Welcome to our Facebook Live. I'm Kim Martino-Sexton with Heartland PMAD, which stands for Perinatal Mood and Anxiety Disorders. And we're here with
My screen says we're live.
with Elizabeth and Louder, my partner at Heartland, and our special guest today, Dr. Melanie McKean, a reproductive psychiatrist with the St. Louis Behavioral Medicine Institute. And we're going to chat for a little bit. We're just getting situated and we see that we're live, but we're waiting to see that we're really live. So hopefully you're seeing this.
Yep,
And
we're good.
I saw us, that's what was coming, and I muted myself for a second because it's the delay, but it was coming through. We were live.
okay, good. So we are live. Excellent. Well, welcome.
Thank you. Thanks for inviting me.
Yeah, thanks for hanging out with us. I know you're probably having some really busy days back to back. So thanks for spending some of your this is probably your lunch break or something. We appreciate it.
No problem. No problem. Happy to do it. Happy to connect with people.
I know, right? Yeah.
So for the next 40 minutes or so, we wanted to check in with Dr. McKean, learn a little bit about what her work looks like right now during our quarantine. And I know I've got some questions, see if anyone else has some questions for Dr. McKean and what some recommendations she might have for us during this time frame for folks who are trying to get connected to psychiatry and support and just in general hear what her thoughts are. So Dr. McKean, we're so excited that you joined us. And let's see, should we start with like a little mini state of how is your practice functioning right now? Like
Sure.
how are you serving your clients, your patients right now?
Sure. So I, as you said, I work at St. Louis Behavioral Medicine Institute, and we are a group. We have a couple different locations and have 4 psychiatrists and I think over 50, probably even more than that, therapists and psychologists that work in our office. And we were very successfully able to roll out a telehealth platform on Zoom back mid-March, actually the week of March 16th. All clinicians that week were converted to Zoom clinical platform. And then since the week of March 23rd, we've been 100% telehealth. And again, predominantly doing that via Zoom. There certainly are folks, if they do not have the capability to do Zoom, we are able to also provide them with telephone appointments as well, because thankfully, and I'm not privy to all the details about billing, but in general, I believe most of your major insurance providers are currently covering at least Zoom sessions comparable to an in-person visit, and reportedly are also supposed to cover telephone sessions comparably or fairly comparably at this time, which in the past, the latter was never covered by insurance whatsoever. Mm-hmm. So we feel very fortunate that we're able to provide, essentially the same frequency and level of care that we had been via Zoom. And between our LinkedIn page and our Facebook page and website, you can learn a lot about our CEO, Jessica Gerfen, has put out like an example of like how you do a Zoom session, and did a little example one of those. So it's working pretty well overall. This is my 4th full week doing it myself. And as I was mentioning to Elizabeth before we got on live today, like my schedule's the same as it has been. Really, the same probably propensity of like no shows or cancellations, but not many. And I've certainly seen a lot of new patients in these last 3.5 weeks that I've been doing this. So again, is it the most ideal situation? No, but in psychiatry, it's not uncommon to do telehealth. There's a lot of telepsychiatry out there. I think is one of the initial areas of doing this kind of medical care. it certainly has its limitations. I do not feel like it's, you know, it doesn't have that face-to-face feel that I, as somebody who doesn't generally do this, has. But, you know, the uniqueness of it is I get to see a lot of my folks, you know, in situations that we've talked about. Like, so I get to see them in their homes. I get to see them sometimes in a more comfortable environment for some of them than coming to the office. So for some, it's actually working out really well. I've had some be like, can we keep doing this after this is all over? And, you know, the answer is like, hopefully. You know, there's been a lot of, again, things that have been loosened. You know, as I already mentioned, insurance companies are currently willing to cover the sessions. We still don't know exactly, honestly, what that looks like from a reimbursement standpoint, because those are just now starting to come in. So as we all know, like, something being covered by insurance doesn't necessarily mean that it's what the reimbursement looks like. So we'll see that from a long-standing point. But then also from a licensure standpoint, you know, I have a Missouri license, and if you work in Missouri, you have a Missouri license, and you're only supposed to see people that are in Missouri with you. But they have loosened those regulations too, so that, like, because obviously we have a lot of patients that live in Illinois, in the St. Louis metropolitan, you know, with my prior license, I technically could only see folks that also are sitting in their homes in Missouri. So right now, and so that makes psychiatry overall more accessible to everyone, because right now, like most states, you could see someone in another state, and there's a lot of this like telehealth available. And so I don't know, even if insurance companies agree to continue to cover in certain situations, you know, you probably can't. Missouri Licensure Board will probably go back to saying you have to still only see people in Missouri. So will I have to get an Illinois license? Maybe. Am I going to get in a license in every state? No, that's not feasible. But
well,
yeah,
I was hoping that you could let the audience know, like, why we work together so often. You know, Heartland's mission is to train and support healthcare and mental health care providers on identifying moms at risk for PMAD, for perinatal mood and anxiety disorders, and training them on our Heartland protocol so that we can really get, you know, good service delivery to moms who need it. But so can you talk about your specialization and you know, why it is that we align so well, I think?
Yeah, so I am the medical director of our Women's Reproductive Mental Health and Wellness program at St. Louis Behavioral Medicine. And so my specialty is anything and all reproductive health, but certainly bread and butter is doing preconception counseling for women contemplating pregnancy who may have a history of a mood or anxiety disorder, as well as seeing women during pregnancy and postpartum, but certainly also do things like premenstrual dysphoric disorder, infertility, pelvic pain, perimenopause. So pretty much all of my new patients these last few weeks via telehealth are women that are pregnant, postpartum, etc., that they can't wait to get connected, because life still goes on despite all of this. Like, these things don't go on pause, and if anything, it's certainly complicated maybe the vision of their pregnancy, whether they're planning a pregnancy, if they are pregnant, what their delivery situation could look like, or if they're postpartum. Again, I have had several of my either continuity or new patients that have just had a baby in the last month. And this is, again, not how they expected to be spending their maternity leave. So being able to still provide them with that evaluation and guidance for medication management has worked well, and still be able to link to the services in the area that provide it. Because again, it's not like now we've able to shift. It's not like you aren't going to have PMADs. They're still definitely prevalent, if not exacerbated by the situation.
Yeah, as if maternity leave or that immediate postpartum period wasn't isolating enough. I can't imagine how, you know, lonely and stressed I might feel if I was bringing home a newborn right now.
Well, right. I was
Weird.
just had a session with someone, and right, that's what we talked about it. And it's been a common theme is yeah, normally you might have people coming in to relieve you,
Yeah.
to let you to watch the baby while you take a nap or while you go do anything. And some have been able to work out situations, like maybe grandma went ahead and moved in like a few weeks ago or something like that. And they're just kind of sheltering in place, like with another family member that was able and amenable to come stay with them. But that's not common. And yes, in a situation where you would expect to be having people dropping by, or certainly like dropping off supplies, and they can still do that, but it certainly does take some of that like joy out of your postpartum time.
Yeah, I had one of my social work friends couldn't join us live, but she sent me a question and it relates to mom. So I thought I would ask it now, if that's okay.
Sure.
This is from Laura Ranaletta at Safe Connections. How can I support some of my expecting mother friends who are potentially having to deliver without their partners or other family members present? So that kind of speaks to some of the regulations that women are encountering at hospitals. And I have the feeling that that's like ever changing, and we're not
right
sure about that. But in general, how can we support, moms that are getting ready to deliver? And can you speak to any conditions of labor and delivery units?
You're correct that things are ever changing. And so, I might hear something one day and something else another day. I think that overall, the very stringent initial recommendations of like a woman might have to deliver by themselves has in general been somewhat stripped. Like that, I think it was realized that was a little bit too isolated. Like we have to provide precautions, but like that is just not a very healthy way for someone to live. So what I've been hearing from my patients that they've been in their conversations with their OB-GYNs is that, they can bring one person, they can have one person with them, which, is generally fairly common to be there. But for some of them, it depends on who is that one person going to be. Is it going to be my partner? Is it going to be my friend? Is it going to be my parent? Is it going to be my doula? Like who is it going to be if I can only have one? And what's the state of COVID at the time that they deliver? Like, there's a difference between like if we're in the midst of like versus if we're on the hopefully like down slope of this, or at least the first downhill slope before the potential next peak. Because some people have partners that are immunocompromised. So even if they might be the person that in general they would be bringing with them to delivery, they might not be the ideal person to bring even in a fairly safe environment. I've certainly been hearing a lot from my OB-GYN colleagues about, the flip side of this, which is also, there have been certainly some occurrences across the country where maybe where someone has been, or if someone has been ill, hasn't been fully disclosed because they want their partner to be there. And then that has been jeopardizing the labor and delivery team too. So you kind of have to balance like supporting moms during this time, but also we need to support the labor and delivery department and making sure that it's safe for everyone for that. So, I certainly always am telling my patients to be advocates for themselves. So I think certainly asking questions often and clearly, not being afraid to find out that information. And again, since everything is changing, if they're like 25 weeks along and they have a conversation with their OB-GYN now about like, well, what does it look like at this hospital that I'm going to deliver, or what is your stance on it? Don't assume that conversation that you had at 25 weeks is the state of affairs at 38 weeks, because a lot could change over these next several weeks. And so just like always, I would say, advocate for yourself, be assertive, like ask questions, don't assume anything, because that unfortunately could lead to more stress and disappointment when you go into labor if you were like, well, this is what I thought it was supposed to be, and then maybe a regulation or something has changed. And certainly feeling free to contact the hospital you're going to deliver at, and to see what their policies and procedures are currently, because yes, I have a lot of healthcare providers that our patients as well, and they can tell me like every day things are changing. So it's okay to be the squeaky wheel right now to find out like what's happening, because again, you could even find out something this week and it's different next week.
So if we have like a friend or a close family member that's pregnant right now and really feeling that anxiety, how do you help a friend? How do you recommend supporting moms in this time of quarantine?
Well, certainly it depends on what's causing them that stress and anxiety. And if it's back to, the last topic, then it's encouraging them again, supporting them, like, you know what, we all have a level of increase. It's a blanket over everyone right now, a little bit layer of anxiety. So the good news about that is we've somewhat normalized stress right now. Like, it's not a stigma at this point in time, at least as much of a stigma. And I'm hoping, again, I'm having people focus on silver linings right now, but not as much of a stigma. And hopefully we'll come out of that about having mental health symptoms at all. But certainly like anxiety and stress. I mean, those words are pervasive in everything right now. So I think it's normalizing it for them. You know what? I'm like, we're all a little bit more anxious. So, I know, like, if you're close and you're being like, I know that already at baseline, you have some anxiety, and I would presume, like all of us, again, normalize, that maybe things are peaked. And certainly being pregnant, you might have a lot of questions, and just help them kind of walk through whatever it is they are stressful about. And again, if it's like, I don't know what's going to happen when I go to the hospital. Okay, well, have you asked your OB-GYN? Because again, a lot of stuff is anticipatory anxiety. It's that prodromal, that buildup, that once you've asked the question or once you've embarked on the actual situation, diffuses to some extent. So a lot of it may be them working something up in their own mind as to like worst case scenario. Yeah. And maybe they just actually need to ask the question. But also it's maintaining all of those good self-care things too. Like, what's their sleep schedule look like right now? What does their nutrition look like right now? Like, are they getting outside? Yes, this week is not as nice as it was last week, but it's also not freezing either. So like getting outside and getting some exposure. It's still sunny outside, like making sure they're doing all those things. Cause that's the stuff I'm hearing people say, like, well, since I don't have to get up quite as early, I'm staying up later. And told folks, I don't care what your routine is at this point. You just need to have something. And you may be having to set expectations and then revise and revise and revise, because nobody knows how they can actually cope. If you were told even 2 months ago, like, you need to figure out now how you're going to be able to live with minimal social interactions and with stores not being open the same amount of hours and all these things, like, can you do it? Can you figure that out? You might have made a plan like 2 months ago, but that probably wouldn't realistically be actually what's you have to execute now.
Yeah. So I hear you saying like schedules are important. Just paying attention to your sleep is important. Getting good nutrition is important. And also I hear you, and this is what I talk to my clients a lot about in my psychotherapy practice, is like, what is it that you need? Do you need more information? Are you having a lot of what if thoughts? Do you need more information? Well, we can get some information. Do you just need, to vent and get it all out? Well, that's legitimate. You know, like sometimes getting it out to a person is helpful. Do you need to, do you need some reassurance? Do you just need some comfort? Those are all valid things. And so that was a good encapsulation, Dr. McKean, of how we can help moms.
Validation, that's been a common topic, and I don't want to take credit for that. I attended a webinar back end of March that was put on by Dr. Lena Perlman and Associates that was focused on supporting families and parents. This was like, right after stay-at-home order and stuff came out, and everyone was switching to online schooling, and how are you going to be able to support? And one of the take-home messages from that webinar was validation of feelings. There's no right or wrong way to be feeling about this situation right now. And not that we have to say, especially in your kids, if you have to, they might be angry and maybe they're like throwing stuff. Okay, well, we don't necessarily have to say that behavior is okay, but validating that, like, how you're feeling about the situation is A, probably not unique, but B, isn't wrong. Like, you can be angry about this time, you can be sad about this time, you can be anxious. And then upon validating that, then, okay, like, what can we do to help you to feel better? What can we do to diffuse that? Which speaks to you saying, like, yeah, do we need more information? Do we need more of this or that? And then the other thing that I've been reviewing with a lot of folks about how they might be feeling has to do with this concept that, again, a couple articles came out towards the end of March about that what we're going through, the emotions you could be cycling through are akin to Elizabeth Kubler-Ross's stages of grief. And that, and if you think about it, if you guys are probably familiar with them, I think maybe if we all need a little refresher, I normally, when I talk about grief with folks, like, I always forget one of them, but I've been so used to, like, doing this now for these past few weeks. But in case denial, bargaining, anger, depression, and acceptance. And this other psychologist by the last name of Kessler, like, who worked with Elizabeth Kubler-Ross on a subsequent work. So her original one was on death and dying. And then he worked with her on one called On Grief and Grieving. Well, he was interviewed again, towards the end of March. I believe it was in the March 23rd Harvard Business Review. And it's an article called That Discomfort You're Feeling. It's called Grief. And they interviewed him. It was like a Q&A with him, but he was talking about this concept that I had never heard before, and perhaps because it was new when he was coining it, called anticipatory grief. So again, this anticipatory anxiety, I'm familiar with, talk about all the time. But anticipatory grief, like seeing what's happening in other parts of the world, and certainly here in the Midwest, like seeing what was maybe happening on the coasts. It wasn't here yet, but it was that forecasting of, like, you're going to be grieving, you're going to have loss, like, it's coming, like, this event's going to be postponed, or you're going to lose someone. But then certainly, like, thinking about how you're seeing people react personally, but then even on a government level, about denial about it, bargaining about what's going to happen, anger about things that are happening. And then over these last 2 to 3 weeks, I think we've moved more into that kind of vacillating between depression and acceptance, and depression and acceptance. And I know I heard over and over again last week, Thursday afternoon, once the governor said schools are officially not going back for the end of the year, and then it trickled down in St. Louis to Archdiocese within an hour or so after that, then all the independents, like, it wasn't surprising. It wasn't like, oh my gosh, I didn't think that was going to happen. But the official sort of, like, proclamation was kind of like a kick in the gut.
It was. I was just going to say it was like a gut punch. Like, we knew it was coming, but there was until they made the proclamation, it was like there was a little bit of hope that there was going to be some normalcy. And I remember the first school noticed that, hey, we're extending spring break essentially in our kids' school district. The kids were all excited, and they were like, yeah, okay. They were like super excited. This last one, I didn't want to even tell them. I felt like it was giving them news that, like, their dog had died. Like, it felt like, it felt different. It felt different. And
I was glad it happened, though, because I had literally earlier that day been, again, in an appointment with someone saying, like, we know that things are going to need to be extended longer. And we were talking through these stages of grief. And I'm like, every time we get a new date that's like 2 or 3 weeks out, we're having to go through it all again. And that we actually just need, like, a date further out, but get acceptance with that date. And then, hey, if we get to actually roll it back, then,
you're pleasantly surprised.
You're pleasantly surprised. But, again, circling back to, like, working with women that are struggling with PMADs, like, I'm walking through that with them, because, again, whether they were in the midst of, some of them were getting ready to start, like, infertility protocols. And unless they were, like, already in it, a lot of those, again, have been put on pause, because a lot of that is looked at as, like, elective procedures.
Yeah, which is so hard for
if you've been, if you've been saving, or if you've been, like, doing the workup and, like, now you're ready to go. But even folks that were just planning to start trying right now, there's a lot of uncertainty about, like, should we do this now or not? Like, is it safe? Is it safe to be pregnant right now? So just kind of walking through that again, that this is kind of derailed, like, it's derailed hope for a lot of people. and happiness. And it just puts kind of a cloud over it. But again, that the silver lining on it is that like they aren't having to walk that alone. It's not their internal struggle of like, of thinking about like, well, these are my cognitive distortions, or these are my depressive symptoms. Like they can commiserate with others about it. So I think that that's, again, somewhat helpful to not feel like you have to hide how you're feeling.
Yeah. We have a mom, a friend of ours that happens to be a mom. And she is watching, and I'm wondering what your take is on this. I've talked to at least 3 clients this week about this exact thing. She says, I struggle with pinpointing where my anxiety comes from, especially now. I can't specifically pinpoint what about all of this that is heightening my anxiety. Any thoughts on the best ways to handle this when you can't quite figure out what's actually causing it? How do you approach that, Dr. McKean, with your clients? I'll reserve my opinion for after I hear.
Okay, fair enough. Sure, like everybody generally, like you have triggers. But as we know, like anxiety doesn't always make sense. Panic doesn't always make sense. OCD doesn't always make sense. And there's so many like physical as well as emotional symptoms. So, you know, if you're having a certain thought that's like looping in your brain, and like that starts to escalate your anxiety, and it keeps going on throughout the day, and then it peaks, like it makes sense to you, like that was the thing that was bothering me. But there can be so many things like under the surface that could exacerbate your anxiety too. And since we are probably a little bit more vulnerable to outside stress right now, we're a little bit more, again, like kind of like still, you can expand on those stages of grief and shock, you know, depending upon who you talk to, it can be one of them. And then, you know, processing and meaning is, I believe what Kessler is like adding on is like a beyond even acceptance, like meaning with that. But, you know, sometimes I also say like, is it that important to figure out what's causing it too? Do we just need to deal with the feelings that you're having, whether that's physical or emotional, and knowing like, okay, how do I diffuse my anxiety so that I can move further on? What are those coping strategies that I have in general? Because again, since a lot of it doesn't make sense, kind of like rashes sometimes, like you never figure out what causes it. I don't know, like sometimes you just have to say like, I'm not going to know what's causing it. But when it comes, what do I do with it? Kind of like a cognitive distortion. Like we can't stop them from coming into our brain. We can only work with what do we do with it once it's there.
Love it. Yes. I'm gonna steal that rash analogy. I think all our moms can relate to that one. Yeah. And so good. That's where I come from, is I always normalize, we want to know why. It is normal, and it's part of human mastery to want to know why something's happening, so that we can, you know, potentially gain a better understanding and have some mastery over our environment, and feel like we can control what's going on. Like if I can figure out why I'm anxious, then maybe I can mitigate that thing that's making me anxious, and then I won't feel that way anymore. I work with clients, as I'm sure you do, with a lot of chronic trauma. And so there's a million reasons why.
Yeah.
There are a million hidden reasons why. And those reasons aren't, I'm not saying that those reasons aren't important, and I don't ever try to dissuade my clients that what they need is to know why. Like that's a need. And I will suggest that maybe right now it's less important to figure out why and more important to treat it, right? Like maybe it's more important right now to give yourself some comfort or some sensory self-care, some mindfulness. Just like if baby was presenting with a rash and crying and uncomfortable, we wouldn't do research till like, you know, for days and days and days figuring out why. We would slap some cream on that baby, right? Like, or gently put the cream on the baby. Right. We wouldn't wait to figure out why. We would give that baby relief right away. Right. And that's why I'm stealing that analogy, right? So let's give whatever it is. And I hear this from moms a lot, but I've been hearing it a lot in quarantine. Is like, gosh, why am I so anxious? And I want to be like, what do you mean why? Like, there's a million reasons why.
It's like the elephant in the room.
It's not a mystery why. I mean, it could be, you know, check from this checklist of multiple reasons why. But more importantly, like, I think getting stuck in that loop of trying to figure out why prevents us from feeling better. and maybe we won't ever know why until we really are feeling better and at a place to like, I personally think that once we can get away from the crisis and the trauma and then look back with perspective, then maybe we can figure out why. But we're in it right now. Like, we're in the crisis right now. It's not time to figure out like, what am I learning from this? We're in it right now.
Well, and from a medical standpoint too, I oftentimes dissuade my patients from trying to figure out the why on the anxiety, because I think it helps them to accept their diagnosis more. Like, because, you know, what we run into a lot in mental health, and certainly as somebody who is viewed a lot of times as like just somebody that's like prescribing medication, do I really need to take this medication? If I just had enough like willpower, or if I could just like, you know, if I just can do like the 5 things on this list, then like I won't have anxiety anymore. And so, you know, I think another stance too is I often try to like to compare their anxiety, like generalized anxiety disorder or major depressive disorder in particular, to like hypothyroidism or like asthma. I'm like, there's nothing that you did. They can present themselves at any age. There's nothing you did to make them come on, but you're gonna need some sort of management for a long time. You know, and some people that have asthma, like sometimes have to take medications for it and sometimes they don't. Or there's certain things that like exacerbate it and sometimes they don't. And with some forms of hypothyroidism, again, occasionally, like you can maybe not always have to take medication if it was the result of some other like physiological stressor over time. But, you know, I really try to get them, or some of them are having to even like explain to their partners, like, why do you still take that medication during pregnancy? Well, because it's a chronic health issue and there isn't a why. It's just, it's my diagnosis, like it's my chronic health condition. And so that's why sometimes I was using a blood pressure analogy with somebody earlier today about, because they were wondering like, well, why still every once in a while do I have like a low day, even if in general it seems like my antidepressant works pretty well generally for depression. And I'm like, well, you know, certainly the goal with prescribing antidepressants with major depressive disorder is remission of symptoms. But truthfully, like, we unfortunately don't see that as often as we would like. So if I can go from someone having like full-blown 2+ week-long major depressive episodes to occasionally now and again having like a low day, like that just might be life. Like that just might be like some of you have good days and bad days. But also I said, you know, sometimes you check your blood pressure and you might check it for days and weeks on your antihypertensive and like, yep, perfect, stone cold, normal, exactly where they want it to be. And then one day, like for some reason it's elevated and you're like, well, I took my medicine and I think that I'm doing everything fine. And it might be like, who knows why today, like it's 10 points higher than it was like all the other days. And just some days that's just still going to happen. Even if you're doing all the things that you're supposed to be doing, because that's just a chronic health condition. So in some of the like, why, like some people be like, well, even though this is going on, like I have, you know, we still have jobs and we still have food and like everybody's healthy, but like, so I don't have a reason to be stressed or a reason to be depressed. And I'm like, also just like pregnancy, like generalized anxiety and MDD, they didn't take a pause just because this stuff happened. Like you could still have exacerbations of them that are separate from the COVID stuff, just because that's the nature of the beast.
Are you hearing a lot of that, Kim, in your mom groups? The idea of like, oh, some moms have it worse. What do I have to complain about? Like, I've got a roof over my head. This shouldn't faze me.
I'm hearing it all. So what I hear the most is the roller coaster. So almost like women are moving through, and I know I'm doing it myself, like having all the stages of grief in one day. So that's fun, right? Like it's not even over weeks. It's kind of like, wow, I could be here and I'm kind of, vacillating or on the roller coaster. And so hearing that a lot in groups and from women who are calling in, and then hearing that, but I know I have it better. So so I don't mean to take up time. And it's like, no, you deserve time. You deserve, validation. You deserve support. no matter what's going on. And so there is that kind of hearing a little bit of everything. And the thing that I'm hearing the most is the isolation with children and the inability to get any type of a break. Because you're all just stuck together all the time. And then we have some moms who are really worried and anxious about going outside and being able to kind of keep their kids from playing with neighbors' kids. So they're avoiding outside. So even little times when they would take kind of a break and their kids would play without them, not even getting that, even if the weather's decent, because of this worry about contact with other people. And kids don't understand you can't play with the neighbors right now, or whatever families are doing. So just a lot of all the issues women have been facing during pregnancy and postpartum on steroids, like just really, really high levels. Lots of pregnant women calling in and joining our groups to talk about what is going to happen and how do I handle this and how do I navigate it. And, everybody's appointments have changed. So OBs are only seeing moms. It's all different, but, they're not seeing them regularly throughout their pregnancy at the moment. And so the moms are wondering, and one of the women who called in yesterday, like her partner can't go with her. So she can only go by herself to her OB appointment. So just all of this, like I'm feeling like I'm forced to be alone on top of, and I really need my support people, and forgetting that we have our phones. I mean, one of the things we keep reminding moms, like, hey, you're never really alone if you can take your phone in, so like bring your phone, keep people on, you can have your partner on Skype. And so that's just a quick amount of what we're seeing. And so I think it's so helpful for moms to hear from, both you, Elizabeth, and Dr. McKean, like ways to navigate through this, because it's new for everyone. And a lot of women, several women have called in and they need to get in to see a psychiatrist. And they're like, but I guess I have to wait. I'm like, no waiting. So I was really glad to hear, Dr. McKean, you said you're seeing new clients as well.
Yeah. Pretty much the same pace as normal. And I'm looking at my schedule right now because I can do that simultaneous to us talking. And yeah, I have availability again for PMAD stuff as soon as 3 weeks from now. So it's most psychiatrists again are available. And again, there are some patients that are not as amenable to Zoom. And so we are having some cancellations here or there. But there's more availability since there's loosening of, again, these insurance and licensure requirements that I don't foresee changing quickly because, again, the country has to get back to some semblance of pre-COVID to really rein back in some of these things. Now, again, an individual insurance plan or an individual state might think differently on that. But, so I also would say that, even locally, like if they could look on the confines of the St. Louis area currently because there's accessibility.
Mm-hmm. I'm posting links for your office and the mom's line. So that's where my brain's at right now.
Yeah.
As you're multitasking.
Yeah.
And so I think, one of the things that a question that's come up with a couple of the expectant moms who are going to be heading to the hospital soon. So some of them are on, are thinking about getting on medication. Mm-hmm. Some of them are on some sort of medication, and they're worried about what happens if they have COVID symptoms. Does that change medication? And, for me, because as you all know, I'm non-clinical, so I'm always like, that's a really good question for your doctor and whoever's prescribing for you, your psychiatrist. Sometimes it is the OB. but that's come up too. Women just, and like you said, trying to think out these scenarios, like, am I going to have to go off my medication if I get sick? How does this play out? And so I don't know, not that you can speak to everybody's individual, but, are there modifications that have to be made to psych meds if moms are test positive for COVID, or is it related to their symptoms, or can you speak to that at all?
It would probably be related more to symptoms. So I'll be honest, I've been very lucky. As far as I know, at least of the patients I've seen in these last few weeks, I haven't had anyone that personally is positive. So I have not yet had to have a direct conversation with someone about, okay, how are you feeling and do we need to adjust anything? But in general, I'm not seeing that topic come across, again, the different groups and stuff I'm in about modifications, with one exception, and that's benzodiazepines. So the respiratory depressants. And so I definitely, because certainly, as you can probably imagine, we're a decent amount of phone calls. They've tapered off, but week of the 16th, week of the 23rd, even the week of the 30th, with all the cascade of changes, a lot of calls for like, hey, can I get a refill on my Xanax that I took the last time 3 years ago? Or, hey, can I get a new prescription for maybe someone who's never taken a benzodiazepine before? And I handle those on a case-by-case basis on whether I refill or even consider a new one. But what I've been emphasizing with everyone is that these medicines are respiratory depressants. And while coronavirus seems to be, the focus is certainly like pulmonary health, but it obviously has a lot of ways that it's harming people's bodies, and it's not always that it's a pulmonary reason why somebody passes from this, or that's the long-term sequelae issues. But nonetheless, like, benzodiazepines are respiratory depressants, and from a clinical standpoint, they're generally also Band-Aids. So if you're somebody that's at a high risk for exposure, I'm encouraging them to not take a benzodiazepine unless they really feel like it's absolutely critical for them, like it's an unremitting panic attack or something like that, and only in the setting of that they feel like that really their chance of having it right now is minimal to none. Like if they've been sheltering in place for 3 weeks and there's nobody that they're around, then they can probably take it safely. But as far as like antidepressants and mood stabilizers and those things, I mean, some of them do have sedation as a side effect. And so I could certainly see, like, if someone was hospitalized and they are really ill, that they might be holding those medications if the side effects were. But to be honest, like if they're hospitalized for COVID, I mean, probably their psychiatric medications are not going to have that much influence on anything positively or negatively, for that matter. And if someone is really ill and having to be put on a ventilator, again, a sedating medication versus not, like they probably would hold anything that wasn't essential, and they probably would look at like some of those medications as in that moment. If you're sedated and on a vent, your psychiatric medications are probably not the most essential. But on the day-to-day, I wouldn't see any adjustments at this point that we need to do.
Mm-hmm. Well, and I think that's reassuring to know. And, and that's what, when I'm encouraging moms to seek out and ask the questions, let's get an answer so you can, you can be reassured. Not that they should be doing a ton of research, because I don't think that's helpful, but like,
and I don't think that there's a ton of information out there for them to find.
Right. Like, so let's just call your doctor and, and find out. And that way, it's one thing off of your plate if that's possible. So I really appreciate that. Well, I'm also noticing the time. So it's about 12:47. We said we'd wrap up here right about this time. And so any final thoughts for us, Dr. McKean, for providers out there, for moms out there who are kind of navigating this at this time that, you'd like to leave us with? Sure.
Just kind of circling back to the topics that we've talked about, but again, I'm spending the majority of my sessions right now. I'm not making any big changes to people's regimens, because a lot of, if they are having any slightly worsening symptoms, you know, again, we're walking through those stages of grief. We're talking about like acute stress disorder and those sorts of things. And I think it's just, again, it's validating people's emotions, and that it would be expected. If anything, I would be more surprised if someone's like, yeah, this really isn't bothering me at all. So
Right.
validating that this certainly could be affecting everyone to some extent, and that all of the that we're reinforcing all the time, like, again, good sleep hygiene, proper nutrition, good self-care, those things are all the more essential now. And that, as far as like how to cope with this, whatever you can handle. I have some people that can think 6 months and 12 months down the line, like, what if we're still doing this then? But I've heard more than once in the past few weeks, like, I can't even think about like what we're going to be doing in August. I can only think about today, or I can only think about this week. And I'm like, that's okay. Like, this isn't a traditional sort of like thought record sort of situation where I can walk you through the cognitive distortion and say, okay, well, we only have to worry about this until this time, or until you get through this hurdle. This is a marathon, not a sprint. And so if you can only think about what you're going to do for the rest of April, then like, let's focus on that. And then we can think about May when we get to May. But I think it's, again, normalizing that it would be expected for there to be some changes in symptoms, but then also a lot of my folks with anxiety are doing just fine because they already have the toolkit. They already have worked a lot in therapy on feeling out of sorts, or like the world doing things around them that they're having to like figure out how to cope with. So a lot of them are well versed and have a good footing with this. And I think, you know, validating that too, that like, you know, you're doing really well considering everything going on. But if you feel like things are out of proportion to the stressors you're presented with, then definitely get in touch with me.
Yeah. Well, thank you so much for spending time.
You're welcome.
Talking to us. I found it really helpful. We've gotten lots of comments that this was really the information that they were looking for. So we're really, really grateful for your expertise.
Well, thanks for inviting me. Always good to talk to you.
Thanks. And thanks for all of you that have been watching and submitting questions and comments. Feel free to look at the links that I put down in the comments to get a hold of Dr. McKean, or the SSM Moms line, or Sage Tree Therapy, or Kim and myself at Heartland. There's lots of resources out there. So take a look, and let's be, you know, supporting each other, and by doing things just like this.
Yep. Stay connected and get support. Thank you, Dr. McKean.
All right. Bye.
Thanks, everyone.
Stay safe.
Bye-bye.
Bye.